Bismillahirrahmanirrahim. Quote of the day is related to my presentation topic. Healthcare is vital to all of us some of the time, but public health is vital to all of us all the time. My topic of presentation is Introduction to Health Policy and Health Policy Triangle under kind supervision of Dr. Saira Afzal. Learning outline of my presentation is policy, difference between public health and health policy, policy process, health policy triangle, and the practical application of health policy triangle. In the end of this presentation, participants will be able to describe the health policy analysis triangle, and its practical application. What is policy? Policies are general statements based on human aspiration, set of values, commitments, assessment of current situation, and an image of desired future situation. Now come the difference between two terminologies, public policies and health policies. Public policies are basically authoritative decisions made in the legislative, executive, or judicial branch of the government intended to direct or influence the action, behaviors, or decision of others. While health policies are aggregate principles, stated or unstated, that characterize the distribution of resources, services, and political influences which directly impact on the health of population. According to WHO, health policy can be defined as the decision, plan, and action that are undertaken to achieve specific healthcare goals within a society. And health policies can achieve several things according to WHO. It defines a vision for the future. It outlines priorities and the expected roles of different groups. It builds consensus and informs people. Health policy development is based on the two landmarks. One landmark is the development of health policy is the worldwide adoption of the goal of health for all, which is given by 2000. And other landmark which is used while making health policy is Alma Ata Declaration in 1978, in which they call all the government and to develop and implement primary healthcare strategies to attain the targets of health for all, and more recently and then the Millennium Development Goals, and now more recently SDGs 2030. Health for all. The main goals which are highlighted in this model is all people in all countries should have at least such a level of health that they are capable of doing work productively and participate actively in social life of community. Health is brought within the reach of everyone. Basically, health for all is a holistic concept in which there is a contribution of different fields like industry, agriculture, housing, communication, and as much as medicine and public health. Spectrum of area which are covered by health policies are financing and delivery of health care, quality of care, access to care, and health equity. There are different categories of health policies like global health policy, mental health policy, pharmaceutical policies, and policies which are directly related to public health like vaccination policy, tobacco control policy, and breastfeeding promotion policies. Different authors give different definitions of the health policies. Like in Mosby's dictionary, they define the statement of decision regarding goal in healthcare and a plan for achieving that goal. For example, to prevent an epidemic, a program for inoculating a population is developed and implemented. In American Journal of Public Health, they define the evidence-based policy, and evidence-based policy is to improve public health outcome. Evidence-based policy is developed through continuous process that use the best available quantitative and qualitative evidences. Now comes the policy cycle, and policy cycle consists of 5 basic steps, which is agenda setting, policy formulation, decision making, policy implementation, and policy evaluation. First is agenda setting. Issue become as significant and draws the attention of policymakers. Health needs are measured: self-report, health status indicator, biomedical measures of health status, and geographic variations. Second stage is policy formation, and various stakeholders are involved in the policy formations like healthcare teams, hospitals, government. They are involved in the formulation of policy. Then comes the decision making. In this stage, solution is chosen and how the stakeholders decided to approach an issue. Fourth stage is policy implementation, and this stage is quite difficult because when you implement any policy or law, then there is a change in the uh, environment or in the community, and people are not easily accepted that change. So the policy implementation is quite a difficult stage because you chosen solution to put into an effect. And then the policy evaluation. Policy should be monitored and evaluated for its impact, whether it is successful or not. Is policy change acceptable? When you implement any policy, then there is a change in the environment or in the community. So that change is acceptable if the policy is based on these 6 steps. Like if there is a need of that policy, then it is acceptable. If everyone is assessed to that policy easily, then it is acceptable. Everyone utilize the policy and there is equality is present in the policy. Equity is also very important in the policy which is implemented, and there are no disparities, then the policy is acceptable easily. There is a health system management level, and in health system management level there are different level on which the policies are made and be implemented. Health management does not refer solely to one level of the practices, but it is a quite broad process which occurs in different levels. Holder and Remigim 2012 refer a model adopted by Orton 1999 who categorized management activities at the micro, meso, and micro level. Macro, meso, and micro level. Macro level basically a government level where the health system policies are made. National health authorities are involved at the macro level. In meso level, the health services are delivered, like in hospitals, family managers, and networks. At micro level, clinical managements where healthcare providers involved in direct provision of clinical care. Macro level. Policies implemented by government with the help of National Health Ministry for achieving national health goals. For example, National Program of Immunization, which is made by the government of Pakistan. Meso level, management of health service and facilities for the population health needs and expectation. For example, provision of the vaccination at all health facility centers. Micro level, direct provision of clinical care. For example, when a child gets vaccination from a vaccination center. Now comes the health policy analysis. Health policy analysis is a multidisciplinary approach to public policies that aim to explain the interaction between institution, interest, and ideas in the policy process. Analysis means separating a problem into its constituent part so as to better understand its whole. Biz et al. Give this definition, and earlier definition is given by Gilson et al. Analysis is an application of knowledge, represent the primary contribution of health policy analysis to governmental decision making. What is health policy triangle? Health policy triangle is developed by Walt and Gilson in 1994, and health policy triangle is based on four elements: context, content, process, and actors. Why need these policies? This come under the heading of context. Content. What is the policy mainly about? Process. How was that policy made? And actors who participate in the policy making. This is the diagrammatic representation of policy triangle. In content, we made an idea for the policy type and scale of the policy. In actors, who are make the policies, like individual, member groups, any organization or government, whose interest and whose ideas. Process is the basic process cycle in which agenda setting, policy formulation, implementation, decision making, and evaluations are come. And in context, there are different factors which influence the policies, like situational factors, structural, cultural, or environmental factors. This is the example of a policy of child and adolescent mental health policy is developed and fit in the scenario of health policy triangle, like in actors, which in the range and characteristic of participant, individual groups or organization in the policy development process, including their role, relationship, interest, agendas, and expertise in child and adolescent mental health. Like in process, forward to consult with key stakeholders across government sector, health, social care, education, private sector, and civil organization. In context, there are social, political, cultural, and health system context within which the child and adolescent mental health policy was developed. And in content, there is the objective, values, vision, services, models, guideline, and implementation plans for child and adolescent mental health services are come. What are the challenges which are facing in the developing countries? Because in the developing countries, the most of the policies, health policies, are not as successful as in the developed countries. So what are the challenges? There are weak regulation and monitoring system, lack of purchasing power, quality of services which are delivered is not adequate, more influences of political system in health policies, and more reliance on the external donor funds. There are different health related programs in Pakistan, like National Program for Family Planning and Maternal and Newborn Child Health Care, Primary Health Care, Expanded Program of Immunization, National AIDS Control Program, Malaria and Dengue Control Program, National Nutrition Program, Hepatitis Program, and nowadays COVID vaccination. If you made a good national policy, then there are different objectives of that national health policies. It achieve an acceptable standard of improved health, increase access to public health system, ensure equitable access to healthcare, create new health infrastructure in areas which are deficient, upgrade existing health infrastructure, promote public-private partnership, suggest ways to increase investment in health, promote effective monitoring and evaluation of current policies, and the implementation of the policies at district level, then there is a chance that the policy is successful. This is the example of programmatic health system on TB. TB DOTS is a program which is successfully run in the different clinical setup to treat the patient of the TB. Sequence of activities designed or implemented is called a program. TB services, which are provided by DOTS, it basically strengthens the primary healthcare system that is available, affordable, acceptable, and responsible. And TB patient register is maintained at each DOT center, which improve the information system. And the treatment given by the DOTS, they strengthen the community-based services. And isoniazid, prophylaxis of isoniazid is given, and it strengthens the secondary prevention from TB. Forms of policy. Basically, there are two forms of policy analysis. One is prospective form and other is retrospective. In prospective policy analysis, there is involves the production and transformation of information before policy action. And in retrospective, this form of analysis involves the production and transformation of information after policies have been implemented. Prospective analysis. It provides quantitative and qualitative information on which we make future decisions. Emphasis on obtaining information about goals and objective of policies. While in retrospective analysis, we studies the data from policies that already have been put in effect. It is usually known as research. It shows what does not work at the macro level. Place primary emphasis on the result of action implementation rather than the process. Why policy analysis is necessary? Policy analysis is necessary for new health reform, past successes and failure, technique and tools to study the characteristic of established policies, how the policies come to be and what are their consequences, assess the outcome of health policies or the impact of policies on people. Policy analysis illustrate the need for intervention. Think seriously about the problem. In recent update, we highlighted the practical application of health policy triangle. This is the research in which the analysis of the impact of newborn survival policies in Pakistan using a policy triangle framework. Basically, in this study, they reviewed the policies of last 15 years for which was made on the newborn survival policies, and then they conclude the result and put that result in the policy triangle framework. We began with the content analysis of federal level policies that address newborn mortality within the context of health system decentralization over the last 20 years. In this slide, these are the policies of last 16 years from 2001 to 2006 for the newborn survival in Pakistan, and then what comes in that policies, it fit in the picture of this health policy triangle. The actors which are involved in these policies are federal government, national program, provincial ministry of health, international donors, and health policy units. And what are the context of these 16 years policies are: incomplete process of decentralization of health since 2010, province mandate to develop province specific policies and plans, gap in coverage of newborn care in public sector healthcare, private sector health utilization increase over the time, constructional semi-government arrangement in the province create confusion about the responsibilities. And content in these policies related to these policies, subsequent policies lacking in essential newborn intervention, lack of adequate reference to evidence used for the policy formulation, unclear evaluation mechanism, and in the process, Most policies are politically motivated top-down policy-making approach, use of old project plans to guide a program implementation, and lack of explicit implementation plans. This is another study which is conducted by using the health policy triangle framework, and it is the basically 5 years review of the SDGs in the country to explore and summarize the application of health policy triangle framework to health related policy decision in the recent literature. Basically establish a prominence in its field. The objective of this review is to explore and summarize the application of health policy triangle framework to health related policy decision in the recent literature from January 2015, when the SDGs were launched, and the January 2020. A review of past literature has previously reported on the wide-ranging use of health policy triangle framework to understand many policies experience in multiple lower middle income countries setting. And in conclusion, given its generalizable nature, future research that applies the health policy triangle framework to smaller scale health policy decision investigated at local and regional level could be beneficial. This is the conclusion of this whole study. Now comes the MCQ session. Government has set up committees at Union Council level which meet regularly to discuss the health issue of the community. Which level the Union Council work? Macro level, meso, micro, primary.
Meso level.
The correct answer is no. The correct answer is meso level, because in this the government has set up the committee at Union Council level, and the Union Council level they meet regularly to discuss health issue but not deliver the healthcare facilities. When the Union Council delivered the healthcare facilities, then it's the micro level. So the correct answer is meso level. A country designed policy for vaccination and its impact on population measured after 2 years. What is the type of this analysis? Prospective, retrospective, interactive health policy analysis.
Retrospective.
Right answer, retrospective, because vaccination policy is implemented and after 2 years they measure its impact. So this is a retrospective analysis. Health policy covers following spectrum of areas except health equity, financing and delivery of care, quality of care, quantity of care.
Quantity of care.
Quantity.
D is the right answer, quantity of care. Government has formulated a policy and increased the tax amount of cigarette to decrease the purchasing power of customer. At which level this policy work? Macro, meso, micro, primary.
Macro level.
Right answer is macro level, because government has formulated a policy. In urban setting, most deliveries conducted in tertiary care hospitals according to health policy triangle. The tertiary healthcare hospital is placed at which segment of triangle? Content, context, process, actors.
B. Context.
D is the right answer, actors, because organization is in actors there are organization or so tertiary care is involved at which the deliveries are conducted. So right answer is D. One of the strength of national health policy is the implementation of healthcare delivery at which level? Provincial, union, district, tehsil level.
District level.
District level. C is the right answer. In current scenario of COVID-19, The SOPs given by the government are not followed in many places. Which stage of policy process cannot fulfilled?
Implementation.
Policy
Implementation. C.
implementation. C is the right answer. Polio vaccination campaign in northern areas of Pakistan facing some social and cultural problems. According to Health Policy Triangle, this problem lies in which heading?
Context.
Context. B.
G, context. B is the right answer. When health manager keep continuous oversight of activities to ensure that they are proceeding according to plan, so he is doing monitoring, recording, planning, or evaluation.
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 No, the right answer is monitoring. Because health manager continuously oversight the activities. So the health manager basically monitors the activities. Sequence of activities designed to implement policies and accomplish objectives is called
Program. D.
Goal.
D, program. Because sequence of activities design and then implement and accomplish objectives. So this is a program. This is the key of the MCQs, and thank you.
Thank you very much, Dr. Naila. Very nice presentation. And you have given an overview of very important terms that would be later discussed in detail. For example, you have talked about the planning cycle, and one of your MCQ is also concerned with planning, evaluation, and monitoring. So we would talk about it in much detail in our later sessions. It is very important to know what is the difference exactly, what is the in-depth difference between evaluation and monitoring, as well as how the planning that encompasses all the evaluation monitoring in order to uptake the situation and how to do the need assessment, general need assessment, specific need assessment, and then come up with certain key information that leads to the formation of indicators, and these indicators are then taken in account when we are doing assessments, and these assessments leads to the holistic approach of evaluation, and these evaluations, they have a integral component of monitoring. So all these things would be discussed later on. However, I have one question from you. You have presented about tertiary care. I would like you to please let us know more about the primary care, secondary care, and tertiary care, how you have classified them according to the content, context, and the actors, etc., while you were presenting us the triangle. Would you please elaborate it further?
Ma'am, basically primary care, and these all are the primary care, secondary level, and tertiary care all comes under the heading of actors, because these all are the organization. Because in primary care setting,
My question is right. My question would be, if they are actor, then what is the importance of different contexts? For example, we know that in basic health units, the context is that the primary health services or the basic health needs that are universally available, that should be given as a basic right to every individual, like mother and child care, like immunization, like chemoprophylaxis, and the basic ailments that should be treated at the local level. So why not it can come under context?
yes, ma'am. Basically, the organization comes in the actors, but the facilities that are provided is come under the heading of context.
I have put this in another context, right? For example, if there are specialities that are needed, there are super specialities that are needed. People may go for their endocrine assessment. They may need certain specialized surgeries for them, like plastic surgery, etc. So this is the real concept of tertiary healthcare, and it is very much embedded in context, content, and then we come with the performance as actors. So I think that one of the demarcation of separating the tertiary healthcare into only the actors, that is perhaps is not the right way. In future presentations, we would discuss more about it, how the context, content, and the service provision at different levels, they are used as actors, and they are being used as one of the stakeholders in assessment of the system and evaluation. So very nicely presented. Thank you very much. And later on, we would have more discussions on these points. See you next time. Allah Hafiz.
Khuda Hafiz.